Welcome back. Roughly 4 to 5 million Canadians don't have a family doctor, and there's no flood of physicians being hired to fill that need. Experts agree the only way to solve the growing wait times across the country is to find efficiencies in the existing system. Jeremy Bahar is the president and CEO of Cirrus Consulting Group. Kevin and I spoke with him earlier, and I began by asking how his firm is trying to help break the bottleneck.
We essentially help drive more efficiency into the healthcare system in Canada. Our very strong belief is that efficiency actually has to start from the bottom up and not necessarily always driven from the top down. Physicians themselves are the ones who have to drive that change, and they're averse to change. They're sometimes seen as cynical people who are a little bit slow to kind of adapt to the changes that are required in the system, and that's where some of the slowdown has happened over the years.
You say they're adverse to change. Would they be averse to making more money in a two-tiered private system?
So two questions. Would they be adverse to making more money, and would they be adverse to a two-tier system? They're not adverse to making more money, and a big part of the change that's actually happening in Ontario now, there's actually quite a revolution happening in Ontario now behind the scenes in the world of primary care. Physicians are actually starting to make a lot more money than they ever have over the years. The average family physician in Canada now is actually making more than the average family physician in the U.S. And that's happening because of a change where physicians have been incentivized over the years, 20, 30 years, to drive patients through in a fee-for-service model. Very simple. You get paid per encounter. In Ontario now, for example, physicians are getting paid per head, capitated payment model, where the province is saying, we will pay you based on the number of patients that you agree to take care of over the course of a year. And what it's actually doing for physicians is it's incentivizing them to not haul patients, a small number or roster of patients, back over and over again, but rather keep the healthy patients healthy and out of the office, and expand the size of their roster to take on more patients. Of the 4 to 5 million Canadians who have no access to primary care physicians, what's happening is, as physicians are realizing that they can deliver care more efficiently to larger numbers of people, they're making more money, and as that's happening and the rosters are growing, some of those 4 to 5 million Canadians over the course of time that we're working with their physicians are actually, that number is going down because more physicians are taking on more rosters, more patients. So rosters are going from 1,000 to 1,200 to 1,400, in some cases to 2,000 patients. If you can take every family physician in the country and add 300 to 400 new patients to their overall roster through the year, you've just had a massive impact on the number of orphaned patients across Canada. And that's really what we have to be doing, is incentivizing them to deliver care differently.
When you talk about the kind of grassroots change that you propose that some doctors resist, be specific. What are you talking about? How could a doctor's office be more efficient?
Well, for example, there's, in many cases, and again, not all, there's a huge lack of collaboration and communication. So let me give you a very specific example. There are many physicians across the country who still practice in one physician, in one office, with one nurse and one receptionist, and that's it. And so they carry this massive infrastructure, even in a small office, all on their own shoulders. And what's happening is we're starting to transition more and more, and physicians are doing it themselves. They're transitioning more into group collaborative care models, where physicians can actually work with 8 or 9 or 10 others, go on vacation. Their patients are still getting cared for, so they're not actually going to the ER if they get sick while the physician's on vacation. They're not walking into a walk-in clinic for one-time care with no history and no future real plans. It's all collaborative care because the colleagues in that office have access to the patient's records, the patient's history, and the physician comes right back and in some cases opens up their EMR system, electronic medical records, and can see what the plan is for the patient, and it just keeps going. So it removes a significant amount of that inefficiency.
Let's get to the real crux of the issue, because many, and I'm one of them, feel that this country deserves to have the efficiencies that the free market provides. We'd like to see a two-tier system. I'd like to pay. I don't want a discount doctor. I want to pay for the most I have to get the best care I possibly can get, and when I need it, I want it.
Yep.
Are we ever going to see that here?
My personal opinion is yes. We've started to see it a little bit. There are some organizations. It started more in the executive health sort of realm, but there are organizations who have sprouted up across the country that are offering this type of executive care, and it hasn't really taken off and become started to grow very significantly yet. I think for a number of reasons. I think that many Canadians are still trying to protect this notion of socialized healthcare. Number one. Number two is there is this change that's going on with physicians across the country where by being paid and operating in a different model, it's actually driving some of the efficiency that just walking into an office, and like in the States, you fly down to Boston, you go see a physician, and you can do it quickly. You can move to the specialist the next day. You can move to another specialist the next day. We're starting to see a little bit more of that here. We haven't really even begun to touch the system and affect it, but that's starting to happen a little bit.
Only about 20 seconds, 30 seconds, but we talked about the orphaned patients at the primary care level. In a system that's more private, would we not have more orphaned patients? Would there not be more people who would be squeezed out because the services were being used by people who could afford it?
Good question. Two sides to that sort of answer. The first one is yes. The second one is no. And the no is a lot of the people who currently access and tap into the Tier 1 system, the public system, would actually voluntarily move themselves over to the paid system because they can and they want to, and they would free up space on that conveyor belt for some of those orphan patients. So.
Jeremy, great to have you here.
Thank you.
Jeremy Behar is President and CEO, Cirrus Consulting Group. Time now for a priceless moment, which